Pessary, ring pessary, or the silicone ring pessary. Pessary is known for to us since more than 200 years. There are more than 123 types of pessaries. Do we use it that common? Nowadays, pessary initially it was used. What was pessary used as was pomegranate. Anar soaked in vinegar was used as a pessary. Just imagine. Don't imagine. We nowadays use a silicone ring pessary. That's the most commonly used ring pessaries nowadays. So, what is its indication? Those patients who are not medically fit for the surgery or those who deny surgery, in that we use the pessary. Is that's the only indication we use the pessary? For those who undergo surgical management, is there any role of pessary in that cases? What are the other indications of pessary? Pessary is not limited only to this condition. Those who are not willing for operative, there are many more things to the pessary. So today in this video, we will see what are the indications of pessary, how it works, and what are the contraindications. So let's get started. So pessary, very importantly, what we know is pessary is used in the management of prolapse and stress urinary incontinence as a first line management. Yes, first line management is in prolapse and stress urinary incontinence. Pessary is the first line management. Okay, then pregnant patient who has severe SUI, neither you can offer any medical management nor surgery is done. And how is the patient will do the exercise in that phase in pregnancy? So that definitely you can offer a pessary. So that's another indication of the pessary to be used. Then the woman who has prolapse but the family is not completed, want to conceive it further. So then there you can offer pessary definitely. The patients who are fit for surgery or who want to undergo surgery or the surgery has been decided, but in that cases where you have to detect for the occult SUI. Yes, occult SUI. For detection of the occult SUI, you need to do the trial of pessary. You need to insert a pessary and see whether after the inserting the pessary the patient is having an occult SUI or not. The detail of this symptoms I have mentioned in my previous video in history taking added examination of prolapse, how to examine the importance of SUI, whether it's present or not present. Okay, so this is the one thing. So to detection of the occult SUI, you need to use the pessary. Then pessary mimics surgery. One more indication. What happens if pessary is used as in prolapse and SUI? So it mimics the surgery. After the surgery, how the patient, what are the patient expectation, goals? The patient gets time to realize. See, one thing you need to very important you need to understand is that patients with urogynecological conditions, they will not tell you all their problems or they don't find it relevant. In urogynecology history, you have to ask the leading questions. Now, a patient comes with a prolapse. Patient may have defecation problem, constipation, or obstructive defecation syndrome. So she might assume it is due to prolapse and she underwants any treatment or surgical for that matter because she thinks if that is corrected, her constipation will go. But we know that rectocele might or may be associated with the defecation bowel symptoms or not. So not necessary that after surgery her symptoms may improve. But if that's the indication the patient sees seeking the treatment, then you need to offer pessary. Definitely not the ring pessary for the posterior vaginal wall prolapse. That the different pessaries are used for the posterior vaginal wall prolapse. But if the patient is having suppose a defecation syndrome, as like I said, occult syndrome, occult SUI, you in a prolapse patient is not complaining of SUI, you insert a pessary and you see the patient is having SUI, then you offer definitely anti-incontinence surgery. So in the same way, prolapse patient with posterior vaginal wall prolapse symptoms, patient is having any defecation, bowel complaints, you insert a pessary for the posterior vaginal wall prolapse and see whether that patient's symptoms are recurring, same, or it's worsening. What is the condition? And then you can counsel or make the patient aware that after surgery, patient can expect this from the surgery result on the posterior vaginal wall prolapse symptoms. Okay. So one is the first line non-surgical management is the pessaries for prolapse and SUI. In pregnancy, you can use those who have not completed family that you can use. Then it to detection of occult SUI, you should use the pessary even if you are planning for the surgical management to decide whether the patient is having occult SUI or not. It's not only during the examination purpose or when you are demonstrating in OPD. You can insert the pessary and leave it for a few weeks. So see with her daily activities with pessary inside whether she's having occult SUI or not. Okay, and it mimics the surgery, so you know them what the patient is expecting out of the surgery, what are her goals, what she want from the surgery. Okay, so these are the indication. What else indication? What will be the prolapse is that then it will help in pelvic floor muscle training. It has an adjuvant. See, for whatever we do the conservative management for SUI prolapse, we do the Kegels, we explain the biofeedback, we give them pessary. So what happens whenever if you have when you teach Kegels to the prolapse patient, you see when you ask the patient to squeeze, instead of squeezing the muscles, they pop it out. Why? Because in prolapse, patients are unable, or majority of patients are unable to identify the pelvic floor muscles or unable to squeeze it. So in that the pessary helps a lot. You can insert a pessary and then teach the Kegel. That will be more effective because there will be not the confounding factor prolapse. It will not hinder it. So by inserting the pessary, the patient will be better able to understand the Kegels. Then again, for the biofeedback, you can teach it with the finger or with the ultrasonography or with the instrumentations, anything. You can teach the patient the biofeedback Kegel exercises how to do, and even with the pessary inside. So it will be the compliance and the results you get the better. So prolapse patient, you advise the Kegel, but if you do it with pessary in situ, the patient will have the better outcome for it. Okay, so this is. Then again, the famous or the most common indication for pessary, which we think is that medical comorbidities. If the patient is having medical comorbidities, then are not able to undergo surgery, then definitely as a conservative, we can advise the pessary. Okay, so this and one more thing is the decubitus ulcer. Patient who have planned for surgery but is having decubitus ulcer. So in that also you may require a pessary. You reposit the prolapse back in the vagina. We all know the pathophysiology of decubitus ulcer because of less blood supply to that region. So there is development of ulcer. So when it's deposited back to the vagina, the healing get better, the ulcer get better, and then you can operate effectively. So these are the indications of the pessary. Okay, so this is such a long list. So these are the indications. Now, how it works? Pessary basically it works by provides a support to the pelvic wall. The pessary, here's are the different sizes of pessary, silicone ring pessary. So this pessary, this is the pelvic floor. Basically, it rests on the pelvic floor or the levator ani. Now, by keeping this in the mind, pessary supports the pelvic floor, pelvic wall. It provides a mechanical obstruction. It rests on the levator ani. Now, when the levator ani, the pelvic floor is deficient, the non-successful fitting of the pessary or the failure of pessary, compliance for the pessary reduces. Again, repeat. I'll repeat it. Pessary, silicone razor rests on the pelvic floor. So, if there is a deficit of perineum, okay, what is the mechanism? It provides basically support to the pelvic walls. It rests on the pelvic floor. Okay, so if in any case where is deficient of perineum, the pessary will not be fitted properly, or there will be high chances that pessary will fall out, come out. Okay, so in this, what is the other treatment? We'll see later on. Okay, so this is the mechanism. Then this is the mechanism of prolapse. How it helps in SUI, stress urinary content. Same, it has a, this is like in SUI there is a knob pessary. In front there is a knob. This is a silicone ring pessary. There is a knob. So that is a knob pessary used for the stress urinary incontinence. How it does it help? It also improves the urethral function, urethral support. It basically decreases the posterior urethrovesical angle. It is elevation of bladder neck. So these are the mechanism of pessary, both in the prolapse and stress urinary incontinence. The importance of pessary to use is that it not only prevents the worsening, it prevents the worsening of prolapse, it prevents the worsening of stress urinary incontinence, it even delays the surgery, and in some cases even cancel surgery. There is no need to perform the surgery because the pessary has done its work very good. There is no prolapse, or patient don't have any system, patient is comfortable using it. So this was the mechanism part of the pessary and its uses. Then there comes the contraindication. What are the contraindications? Why, in which cases you should not use the pessary, should not be used? So very first important, remember, infection. Acute infection, any patient with infection, pyometra, you don't use pessary. You first treat the infection, then you use the pessary. So if any infection, first you treat the infection, then use. Then in any case of cancer of genitourinary cancer, vulva, vagina, cervix, endometrial, sea ovary, any cancer patient, you don't use offer pessary in that. Okay, then severely atrophic vagina, that also you don't use the pessary. You first treat the atrophy with local hormone supplementation, and then you use the pessary, not without it. Then comes the radiotherapy. Patient who are receiving radiotherapy, that is also a contraindication for pessary. You don't use pessary in that cases. Then patient who has very short vagina, TVL less than 5, for that matter 6, very high chances of again pessary failure. There is pain with pessary, so you don't use pessary in that case. Narrow vagina, not an indication, contraindication for use of pessary. Very short, narrow, usually the patient will have pain when you insert a pessary, is not able to hold it properly, so you don't use. Any urogynecological complaint with pain, first treat the pain. Pain is very notorious. मतलब it has a many reasons to it. When female with gynae, neurogynae, we have so many causes to the pain. So is there. So there is one opportunity for you. There is one female pelvic pain association. It's organizing its first annual conference on pain. In this conference, you will get to know what is the pathophysiology of pain, all what are the causes, what's the mechanism, what are the different conditions associated with pain, and how to manage, how to treat them, and how to follow up. So it's going to be a great event, 20 and 21st of April at Medanta. So those who are interested should definitely attend this conference. Okay. So back to our contraindications. So this was the pain, very short vagina, this you not use. Then any patient with mesh erosion, those who are also having mesh erosion, you will not definitely not insert a pessary. Okay, or even for those who have mesh, suppose for SUI and then they have prolapse, still you avoid inserting pessary in that. Any case, known case of mesh erosion, you don't insert a pessary. That's a contraindication for patients who have mesh for or done for SUI, or those who have prolapse, mesh has been treated like sacrocolpopexy or sacrohysteropexy, abdominal root, lap root. That's also you better to avoid the pessary. Okay, that. Then those women who are sexually active, and then that patients you will not insert the gel horn pessary because they were active. Then daily it's removal. A patient can't assume the sexual activity if it's a gel horn pessary. Then who patients who have latex allergy, that the inflatable pessary is there. It's not used nowadays. So what is that? The silicone pessary which we are having nowadays, what we use the silicone pessary, it's a non-allergic, it does not absorb any fluid, it does not give any odor. So what latex does is it absorbs the fluid, so it becomes toxic, the smell is produced, so we don't use it. But those who have latex allergy, that inflatable wall pessary should not be used. Silicone ring pessary you can use of those who have latex allergy. So any other contraindication? I think we are done. Yes. Most important, yes. The most important contraindication. And the one thing if you have to remember about pessary, then that is patients who are non-compliant to follow pessary should not be inserted. I repeat, patient who can't follow, who are unwilling to follow, who can't follow, unwilling to follow up, they should are not the ideal candidates for pessary. Pessary should be offered to the patients, female, who are willing to have a follow up. Please do not insert pessary who are not. That's a very important and a big contraindication. Not compliant, self-care who can't take, or there is no proper self-care for the patient, or mobility, dexterity. These are all prerequisite. This we'll discuss in the next video. What are the indication prerequisite for the pessary? So patient who can't compliant for the follow. So please do like chronic prolapse. Okay, once you insert the pessary, then you call, can't follow, don't insert a pessary. So any one thing if you have to remember about pessary is pessary to be not to be inserted who will not follow or non-compliant for the follow. So hope indication, mechanism and contraindications are clear. And if you found this video helpful, please like, share and subscribe. Thank you.